Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD, Doctor of Medicine in Ayurvedic medicine, that is Kaya Chikitsa subject, and in Ayurvedic physiology also, I have done my post-graduation, that is MD. For paid online consultation, you are always welcome and take the help of Ayurveda Academy expert team of the doctors. You can WhatsApp me on 9226810630. My dear friends, we are making the series like a TV serial, Ayurveda in GP or Ayurveda in general medical practice. Today's discussion is based on very important topic which is called as a hypertension, and also we will discuss something about the hypotension. Actually, hypertension is not the word that we can see in Ayurvedic Samhita Granthas, in Charaka Sushruta Vagbhata. There will not be directly this particular English word, but I am damn sure, I assure you that all these conditions can be understood by understanding Ayurvedic basic principles of Dosha Dhatu Malavijnana. Dosha, Vata, Pitta, Kapha are the bioenergies, and this hypertension is related with your blood pressure. When the heart is pumping the blood to whole of the body from the head to the toe, naturally it has to be some pressure. But if that pressure goes beyond the limit, that is called as a hypertension. The tension on the blood vessels. Try to understand. What is the blood pressure? It is the lateral pressure exerted by the blood on the blood vessel walls. Try to understand lateral pressure. Normally, it should be of everybody, adult person, 120 by 80 mm of Hg. Now there is a mercury manometers are available, even lead, the blood BP apparatus are available, even the digital blood pressure apparatus are available. So I request all of you, if possible, and if there is a tendency in your family members of the cardiac problems or kidney problems or the liver problems, and you have somewhere here and there any hypertensive patient at your home, don't hesitate to take the digital blood pressure and keep on regularly checking your blood pressure, especially the hypertensive patient. Because I personally request all of you, because I have seen so many patients of very unfortunate type of the happenings in their lives, when you forget to take the single tablet of allopathic antihypertensive medicine, that can make havoc, my dear friends. Please take it from me, because somebody, they feel that, okay, what will happen if single tablet here and there. I was on the tour, business tour, I was visited to my son in the America, I forgot to take the tablets, this and that, the shops were closed, there were some morchas and the dangal was there. So be careful, be careful. Especially I am talking about the PP patient having the BP, hypertension, and they are taking the allopathic medicines. They are good medicines, but if you miss that medicine, that can make havoc, especially it can make a brain hemorrhage. I'm not afraiding you. I'm not afraiding you. Yes, but I'm warning you. I'm warning you very strictly, very boldly. So if you miss blood pressure tablet, that can all of a sudden brain hemorrhage, and that can make the person die, or well, this whole life you will be dependent because of the hemiplegia. So my dear friends, be careful about the blood pressure problem. Blood pressure is depend on the two factors, cardiac output and peripheral resistance. Now this particular disease is called as a lifestyle disorder. ट्राई टू अंडरस्टैंड लाइफस्टाइल, हमारी जीवन शैली बहुत बेकार की हो गई है। हम खाते पीते में ध्यान नहीं देते, हमारी काम व्यापार में ध्यान नहीं देते, उछल कूद करते रहते हैं, बहुत स्ट्रेस रहता है, मेंटल टेंशन रहती है। इन सब से ऑल दीज कॉजेस योर बैड फूड हैबिट्स, फास्ट फूड प्लस fast lifestyle is equal to fast death. This is the statement by Dr. Deshpande. Fast food plus fast lifestyle is equal to fast death or fast degeneration. So be careful. These are the lifestyle disorders. You should be very, very peculiar about your regular timetable. Stress management should be there. You should do some yogasana, pranayam, shavasana, breathing postures, deep breathing exercises, and relaxing techniques, having some hobbies, taking the break in your work. Everything is very essential. Like alcoholics is a bad, workaholic is also bad. Too much running, rat race, too much ambitious, too much, how many likes are there and how many my reels are making popular, how much money I am earning. Basically, mental peace is far more important than, and hypertension in Ayurveda, it is called as a Pitta Vrita Vata. So there are two things. One is a Vata and second is a Pitta. So you have to avoid the Vata and Pitta Prakopa. Also, there is a danger of the cholesterol level because in the old age, our arteries are become hard. That is called as arteriosclerosis. Arteriosclerosis. But when in the hard, rough arteries, cholesterol is getting deposited, it is called as atherosclerosis. Arteriosclerosis, only hardening. Atherosclerosis, cholesterol deposit. So fatty food, high calorie food, obesity, diabetes, definitely these are the causes of secondary hypertension. Nowadays, it is very common that nobody diagnose, one can diagnose about the hypertension, why it is happening. That is moreover, more time accidentally detected. Like for example, pre-operative checkup by the medical doctor, or even you get the life insurance or the LIC. You want some, take the LIC or the insurance, medical insurance. Then there is a checking and find out, oh my God, I have the hypertension. So this is the all the time cases. Second important thing about the hypertension, I have mentioned normal our blood pressure 120 by 80 mm of Hg. 120 is called as a systolic blood pressure and 80 is called as a diastolic blood pressure. Try to understand very carefully. 120 by 80, 120 systolic, maximum pressure exerted by the heart on the blood vessel is called as a systolic blood pressure, and 80 is a minimum pressure exerted by the heart on the blood vessels. Now, in hypertension, diastolic blood pressure is more important. 80 to 90, okay, warning. Above 90 to 100, mild hypertension. 100 to 110, that is a moderate hypertension. Above 110, diastolic. नीचे वाला जो है ना वो बढ़ गया ज्यादा, तो उसको बोलते हैं hypertension. And hypotension, low BP, is in casual way, in the general practice level, common man moving here and there, and somebody saying, some lady is saying that doctor has told me weakness is because of the low BP. I don't agree with this term. Hypotension is above 120 figure, above systolic, is below 60. Then that is really hypotension. Otherwise, it is 110 by 80, 100 by 70. No, don't worry. Be happy. Above 120 figure goes down 60, that is really hypotension or low blood pressure, and that is an emergency. This can happen when there is a tremendous blood loss during the operation, during the road accidents, then low BP can happen. If there is a lot of what you can say, the diarrhea, loose motions, vomiting, gastroenteritis, food poisoning, water loss is there, dehydration is there, then there can be the blood pressure can be low. So I think I have explained basic things about the hypertension and hypotension. Now let us start to discuss about whatever has been, I have made that particular notes, that hypertension causes, investigations, and the treatment, Ayurvedic treatment. Okay. So etiology for the hypertension, etiology is always causes. Essential hypertension, that is a primary hypertension, no specific cause can be found out. Idiopathic, I don't know, doctors say maybe because of lifestyle, because of the food, general. But secondary hypertension, there are different reasons. For example, reason may be the kidney, reason may be the endocrine problem, reason may be the heart problem, reason may be the brain, so many. So this is called as secondary. And your efforts, when we can diagnose that is my hypertension is essential hypertension or primary hypertension, when we rule out the secondary hypertension causes, then only you can say I don't have any cause. Without testing anything, you are saying I don't know why my hypertension. No, it is called as a primary hypertension is a diagnosis of exclusion. Diagnosis of exclusion. You have to rule out the causes of secondary hypertension. Renal causes, kidney problem, severe unilateral renal disease, that is hydronephrosis, water, renal infarction, that the problem in the renal artery, like a heart artery, renal artery is also problem. Trauma, unilateral pyelonephritis, pus, infection. Bilateral, both right and left kidney, they have the problem like glomerulonephritis, chronic pyelo means pus, analgesic, vein nephropathy. For example, many people take the long-term Combiflam. Slight headache, take the Combiflam. Headache, take the Combiflam. And repeat it every day, Combiflam, Combiflam. Oh my God. That can make analgesic nephropathy, damage to the kidney because of the analgesic medicines. Polycystic disease of the kidney, enlarged prostate gland. Again, for your convenience, I think I have forgot, but I think I should do it because it is more easy to understand. Is very easy. We can concentrate on that part, and search cursor is moving here and there. Prostate in the male, benign prostatic hypertrophy, that can be the cause. Then urethral stricture with bilateral hydronephrosis. Stricture is a fibrosis. Because of the repeated catheterization, the tissues are becoming fibrosed, non-working. Systemic diseases involving the kidney, like polyarteritis nodosa. Can you see the cursor? Disseminated lupus erythematosus and diabetes. Don't forget diabetes. Obesity, diabetes are definitely behind that hypertension problem. So if you want to reduce BP, start walking. No sugar, no carbohydrate, 5 toxic white substances. You know that? Salt. Salt should be restricted. Sugar should be restricted. Maida should be restricted. Yes, that should be restricted. Otherwise, obesity must come down. You have to reduce your weight, automatically BP will come down. Automatically. You control your diabetes, automatically your BP will be normal. Okay? Then kidney transplantation, that also can be the cause of hypertension. We will go further. Now, these are the causes of secondary hypertension. Here you can see endocrine, hormonal, acromegaly, growth hormone problem, Cushing's syndrome, steroid, very dangerous drug. Try to understand steroid. That is a tablet, why so long? Or tablet, prednisolone, very dangerous tablets. They are like a magic pills. On one side, they are extremely beneficial. On the other side, oh my God. That means we doctors, look, that means allopathy doctors, they are using the Visolon tablet, 40 milligram, 1 TDS, then 1 BD for 3 days, 1 OD. So tapering, slowly slow down that steroid, and then it should be stopped. But they are given for the rheumatoid arthritis, pain will be immediately covered. Glomerulonephritis, nephrotic syndrome, steroid is always given. Bronchial asthma, many times steroid is given. But if the patient is taking this Visolon tablet, prednisolone tablet, directly from the shopkeeper, medicinal shopkeeper, and taking by himself for months together, havoc. He will develop obesity. He will develop hypertension. Steroid. He will develop diabetes. He will develop ulcer, moon-shaped face, Cushing syndrome. Oh my God, so many problems. So prednisolone, is it a good or bad? It is good, but it is also bad if the patient takes by himself. Remember these words. I think you can understand that eager of teaching to the people by the short and very simple language by Dr. Deshpande. I am trying my level best to make you aware, to make you a knowledgeable person regarding the health issues. Okay, let us see further without wasting much time. Cardiovascular, Cushing syndrome we have seen just now, overdose of the steroid. Coarctation of the aorta. Aorta is the biggest artery from the heart. Raised systolic pressure in aortic regurgitation. There are the valves. So when the valves are weak, some blood comes back, that is regurgitation. And backflow is stopped, that is stenosis, hardening. Okay. Then complete heart block. Then cerebral, brain causes. Increased intracranial pressure, encephalitis, bulbar poliomyelitis, and cerebral trauma, road accidents. Toxic causes, pregnancy toxemia. Then how you can diagnose? In the female who is pregnant, always check blood pressure regularly. Then check the urine for albuminuria. Okay, and see also the edema. So if the three things are coming together, blood pressure is raised, there is a pedal edema or the edema on the body, and the urine is albuminuria, serious for the pregnant woman. Abortion may take place. This is called as a uremic toxemia. Okay, eclampsia. Then steroids, oral contraceptives. This is also one of the cause of hypertension, lead and polycythemia vera. My dear friends, we will talk about the investigations for the hypertension. So these are the investigations. Renal function test like urea, UREA blood test, and creatinine. ECG to rule out the cardiac problems. blood sugar, fasting and post glucose if non-diabetic, and if it is diabetic, fasting and post prandial after food, after lunch, and also glycosylated hemoglobin HB1AC, which will give you the average of last 3-month sugar level. Then serum lipid, most important, this dyslipidemia, cholesterol above 200 milligram percent, triglyceride above 150 milligram percent. Then HDL cholesterol, good cholesterol is less, but LDL, bad cholesterol, more. VLDL, very, very bad cholesterol, very high. So these are the names: HDL, good cholesterol; LDL, bad cholesterol. Okay. Then treatment, first to rule out the cause and treat accordingly, medicines as per the blood pressure. For example, diastolic is less than 90 mm of Hg. Simple medicines. Ciledine tablets, 2 tablets 3 times in a day from Allersin company. Then Sapera Fort from Charak company, 2 tablets at bedtime. We will go further. Diastolic moderate hypertension, 90 to 100. Here you have to take precaution of the food. No salt, extra salt. Absolute reduce the salt. Second, start meditation and yoga. Third, start immediate walking. Regular 45 minutes simple walking. No, what you can say, the shopping, window shopping. No, simple walking. Okay, without headphones, without mobile and all these things. Nothing. Okay. So Abana from Himalaya company, 2 tablets 3 times in a day. And also Punarnavaso, that is diuretic, 4 teaspoons with equal amount of water 2 times after meals. Now, let us go ahead. Diastolic blood pressure, more than 100 mm of Hg. Then Suvarna Sutta Shekhar, because hypertension according to Ayurveda, Pitta Vrutavat. So 30 milligram with honey every 5 minutes, Chatan, licking. Then Rasagandha, Ayurved, Rasashala, Pune Pharmacy, 2 tablets 3 times in a day. Then Sutta Shekhar Ras Sadha, 2 tablets 3 times in a day. Arogyavardhini, 2 tablets 3 times in a day. Especially, I will recommend Arogyavardhini is the best liver tonic, and liver is the biggest industry in our body. So when we say that this is a what you can say, the lifestyle disorder, or this is a metabolic disorder, then we have to correct the protein, carbohydrate, fat metabolism, and that can be corrected when your liver is functioning well. So liver tonic, liver rasayan, best rasayan is Arogyavardhini tablet, which contains 50% Kutaki, Picroheza Kuru. Especially when your normal medicines are not working, then Arogyavardhini you must add in the antihypertensive management. Then there is a Duralabadi Kadha, 4 teaspoons with equal amount of water 2 times in a day. Next, another prescription, very many prescriptions by Dr. Deshpande for hypertension. Because Ayurveda says, Dushyam Desham Balam Kalam, Analam Prakritim Vayaha, Satvam Satyam Tatha Aharam, Avasthascha Prutagvidaha. I am sorry, my viewers. Some are the very classic shlokas from Ayurveda. Just hear and forget. Okay. Arogyavardhini, 2 tablets 3 times in a day. Gokshuradi Gugulu. Gokshur is Tribulus terrestris, which is also diuretic and rasayan for the kidney. 2 tablets 3 times in a day. Rasayana Churna contains Guduchi, Shatavari, Amalaki, and Ashwagandha. Rasayana Churna, all the 4 immunomodulator drugs. Gokshur, Shatavari, Ashwagandha, Guduchi. Okay. 1 teaspoon 2 times in a day. Ciledine from Allersin company, 2 tablets at bedtime. Now, another prescriptions, my dear friends, the different, these are the, every patient, the doctor will decide which patient should receive which type of the treatment. Suvarna Sutta Shekhar, whenever there is a indigestion and pitta increased, Tapyaji Loho, when the patient is anemic, better way, and hypertension, Tapyaji Lohovati, Sarpagandha Churna, when there is a lot of stress in your mind, the sleep is not proper, insomnia patient, and anxiolytic, Ayurvedic, this Sarpagandha is anxiolytic, will reduce the anxiety. Then Chandra Kalaras, when there is a lot of heat in the body, menopause woman, then Chandra Kalaras essential, 325 milligram. Then Pravala Basma anti-pitta, 350 milligram 3 times in a day. Next, then is again, you can see Allersin company, Argin tablet, 2 tablets 3 times in a day, or Ayurved Rasashala Pune, Proshama liquid is also available, Proshama tablet is also available. Proshama is the best for reducing the anxiety and tensions, 2 tablets 3 times in a day. Then another prescription, Raupya Suvarna Suta Shekhar, Ayurved Seva Sangh Nashik, 2 tablets 2 times in a day. Abana from Himalaya Company, 2 tablets 3 times in a day. Next prescription, my dear friends, Sapera tablets, mild and food, both are available from Charak Company, 1 tablet 3 times in a day. Sarpina Himalaya Company, 2 tablets 3 times in a day. In spite of this, you can also go for Sarpagandha tablet, 2 tablets 3 times in a day. Now, regimen, what should be the Pathya in Ayurveda? You must understand this. Regular diet, regular lifestyle, regular timing of your lifestyle. Salt, restrict. Sugar, restrict. Oily substances, fatty substances, high calorie food, no. Spicy, irritating, rice too much, potato too much, increase the weight. That is bad for the hypertension. High protein diet, ice cream, cold drinks should be avoided. Stay away from lavish lifestyle, sedentary lifestyle like this. Then day sleep should be avoided. Sitting for a longer time should also be avoided. Have enough rest, sound sleep, and no stress and worries or the fear also. Watch for the urine output very carefully. All the said medicines are not essential for hypertension. If any other reason found, please, according to the cause, you have to treat it. Check the body mass index for the obesity. Patient education and assurance is also important. Now about the hypotension, that is low blood pressure. Except shock that I have already discussed in the beginning of the video, please redefine low blood pressure as a systolic blood pressure. Systolic, which is normally 120. When it is less than 90 mm of Hg, most of the patients got their normal range as 100 to 110 mm of Hg. There are chances that the patient is more stressed about pressure values than the low pressure. There is always a fear in the mind of the people. Doctor, whether I have the hypertension, doctor, whether I have the low BP, high BP, low BP, high BP, always, how much? Don't take stress. Don't take stress. Don't wait even. Now, yesterday I had the 90 kg. Today I have the 89.5. Oh, forget about the figures. Forget about the figures. That figure also make the stress. Don't do that. Okay. Make sure not to label the patient as having low blood pressure, even if, I will mark that for you. We are discussing these things. Even if occasionally there is a dizziness, brahma, weakness or sleeplessness, insomnia, as a doctor, always watch for the BP, but do not be in a hurry to come to a conclusion. Patient may be unduly get worried. The patients whose pressure values are on the lower side are less prone to have any kidney, any heart problem. So low BP, that means not serious low BP, normal low BP is better than the high BP. Remember these things. Give enough assurance to the patient so that he is not afraid of the pressure values. Make sure that there is no underlying pathology. Very rarely, Addison's disease can cause hypotension. Now, the symptomatic treatment to control the low blood pressure, for strengthening the patient, gold compound from Ayurveda Rasashala Pune, 1 tablet 2 times in a day with milk. Ashwagandha Arishta, 4 teaspoons with equal amount of water 2 times in a day. Or Guduchi 2 tablet at bedtime. Then another supplement, for example, Protsahana. It's like a sugar granules, not for diabetic. Ayurved Seva Sangha Nashik, 2 teaspoons 2 times in a day with milk, of course. Then Suvarna Makshikadi Vati, if your hemoglobin is less than 12 gram %, best. Suvarna Makshikadi Vati, Hari Parushuram Aushadale, pharmacy from Khadiwale Vaidya Pune city. 2 tablets 3 times in a day. Then Shatavari Kalpa, sugar granules, not for a diabetic patient, 2 teaspoons 2 times in a day. Then Alpitone syrup from Zandu Company, 4 teaspoons 2 times in a day. In addition to that, always advise the patient regular and high calorie diet, because that is a Dhatu Kshayajanya Vata Prakop. When there is BP is low, in Ayurveda it is called as a Dhatu Kshayajanya Vata Prakop. Rasa, Rakta, Maus, Med, Asti, Manja, Shukra, Dhatus may not have the Uttama Sarata. You have to find out which Dhatu is a weak quality and quantity and treat it accordingly. Enough physical and mental rest, regular and enough sound sleep. Stay away from the stress, fear, anxiety, sorrow, and be happy and contented. टेंशन काय को लेने का, सही बोलता. ये जो स्टेटमेंट है ना, इट्स फ्रॉम द मुन्ना भाई एमबीबीएस पिक्चर. I'm not going into the details of that content, but I'm just taking you. Always one should have the attitude like a happy and enjoyment of the life. Okay, so my dear friend, this is all about the hypertension as well as the hypotension explained and discussed by Professor Deshpande. I again all the time request you, please don't forget to subscribe my YouTube channel and give me the encouragement to make such a simple and very interesting videos for you. I wish you all the best. Take care and see you in the next video. Thank you.